All right, and we are live. Welcome back to another session, friends. Today we're going to talk about a social media post that the World Health Organization recently shared, and I think it's revealing, and a lot of us have felt this way early on in this pandemic. And I do want to acknowledge the World Health Organization for coming out and saying this, because I think it gives more credence and credibility to some of the messages that you and people that you trust and respect and people like myself and a lot of friends that I communicate with, we've been saying this early on in this pandemic. One of my very first posts when I saw all the face masks go out of stock at a Walgreens in January, but yet I saw a bunch of people going to McDonald's, I thought, you know what, people are going to confuse the mitigation strategies and they're not going to take their diet and lifestyle seriously, but they're just going to wash their hands and wear a face mask, and that's not going to be a good thing. I saw this in January. I made a post about it, and it resonated with a few people, but I got accused of being insensitive, a grandma killer, and I want people to die. That was not my message at all. My message was exactly what the World Health Organization is sharing here: is we also need to simultaneously address non-communicable diseases. For those of you that are not really familiar with that word, let's just quickly break it down. Non-communicable diseases are diseases that are not transmitted from pathogens, for example, like COVID-19, like influenza. So we're talking about diseases of lifestyle, of poor nutrition, of inactivity, of sleep and circadian rhythm imbalances, of inflammation. So these diseases include, but are not limited to, type 2 diabetes, obesity, hypertension, cardiovascular disease, being overweight, cancer, autoimmunity. A lot of these, if you look at cancer, I mean, there's some genetic, predispositions, but there's a lot of environmental reasons why people get cancer, a lot of environmental and nutrition reasons why people get complications with obesity, like, having cardiovascular disease and type 2 diabetes and so forth. So what I've been trying to say on this channel for a long time, and I know a lot of you have unsubscribed, a lot of you, Mike, you're insensitive, you don't care about my grandmother. That couldn't be further from the truth. I care about everyone. That's why I have a health channel. And I know a lot of health people that you follow that maybe you got triggered by watching their information. You thought they were insensitive, but what they maybe didn't, kind of articulate in the best possible words so that you understood is all of our strategies that we implemented on society at large, the stay-home orders, the lockdowns, the closing of the parks, the closing of gyms, the preventing people from going outside. In Australia, they are limiting just recently how many hours a day people can be outside. It's 1 hour per day. I mean, this is a recipe to propel the prevalence of non-communicable diseases like diabetes, like obesity, like cardiovascular disease, which again, if you're not seeing the image that I'm sharing with you, this is right from the World Health Organization's social media page. Interestingly, this particular image that I'm sharing with you now was the last of like 5 of them. And I'll just read it to you right here. I know you can read this, but for some of you that just listen to these, healthier people can more easily fight off disease. Healthier people can more easily fight off disease. Wow, what a shocker. Who would have ever thought healthier people can more easily fight off disease? Breaking news to me. Just kidding. COVID-19 recovery plans must address non-communicable diseases. Okay, so if our recovery plan, and this is going on in California, this is going on in New York right now, this is going on in New Jersey, this is going on in my state of Washington. People are having restricted access to physical fitness centers because of the virus. Okay, governors, mayors, policymakers, please pay attention here. Please pay attention. This is the World Health Organization saying that our recovery plan must also include and, weave in and account for non-communicable diseases, diet and lifestyle related diseases, obesity, hypertension, cardiovascular disease, autoimmunity, cancer, right? We need to consider that. And so again, I shared this post just on my Instagram. So if we're not yet friends on Instagram, it's metabolic_Mike. And I was just really impressed how many people shared this. This was shared 7,000 times on Instagram. And because people are waking up to the fact, we were all scared at first. We didn't know exactly if everyone was going to be equally susceptible to this disease compared to other people, but we now know that the susceptibility is not the same for everyone. Healthier people tend to have better outcomes. And again, the WHO said obesity can increase the risk of severe COVID-19 infection by 7-fold. And so, gosh, what did we do to people and their prevalence of obesity? We increased it, right? We locked people in their homes for months at a time. We canceled sports. We restricted access to parks. We made restricted access to beaches, all of these things. So what did we do to the obesity? We probably increased it. What did we do to the blood sugar variability and blood sugar oscillations? We probably didn't make it any better. In fact, looking at past data that we've talked about on this channel at nauseum over the last several months is glycemic variability and blood sugar oscillations and high blood sugar oscillations. What do those do? Those increase risk of vulnerability and increased disease susceptibility. They're associated with requirement for mechanical ventilation, intubation, and various aspects of hospitalization, which include use of corticosteroids, antibiotics, and so forth. So, and we know data from past tsunamis and things in different parts of the world have shown that for every day that people are locked in their homes, for whether it's a tsunami or a pandemic, that makes their blood sugar regulation worse. And we have that data. And so we made people's blood sugar issues worse. I do one-on-one coaching a lot. I have so many people that literally are crying on our Zoom calls. They're embarrassed at how much weight they gain. They took many steps back in their health. They didn't go forward. They went back. A few really diehard people went forward. And so, again, a lot of you accuse me of being insensitive and a grandma killer and all this and sarcastic and not taking this thing seriously. I took it seriously, but I was being sarcastic in the sense that the powers that be didn't address the diet and lifestyle related diseases. And so they went on to, share this thing, stay healthy to beat COVID-19. Avoid alcohol. Where was this message in March? Guys, alcohol sales went through the roof. Well, I think wine sales in California alone were up like 130% year over year. Quit tobacco. We didn't really hear anything about that. Be physically active. It's hard to be physically active if you're locked in your home, if you're discouraging people from leaving their house, if you close down gyms and parks and cancel sports. It's hard to be physically active. So again, we can learn from our mistakes. Let's please never do this again and lock people in their homes again. And let's just think better, guys. Let's not accuse people of being grandma killers if they're questioning why gyms are being closed. Let's not accuse people of being grandma killers for hiking without a face mask and being outdoors. Let's use better thinking. We know that not everyone knows everything. But if someone says something like, yeah, we should open gyms, instead of accusing them of being insensitive and wanting to kill your grandmother, why don't you say, what makes you say that? And maybe you didn't realize, maybe there's a lot of people that didn't realize that their state of health, their immunological health, their blood sugar health, that affected their immune system. A lot of people, they don't know that. I mean, literally, it seems common sense to you. But a lot of people that you communicate with on a daily basis, your friends, your family, your colleagues, they literally don't know this stuff because it's not being talked about. This is one of the first times it's being talked about. So we got to share that message. And I do want to let you guys and gals know that these videos are brought to you by your very own Myoscience Nutrition. We have a great promotion going on right now, end of summer sale. You can save 17% off some amazing formulas, including our autophagy enhancer bundle, our DIY electrolyte combination with magnesium and myo-inositol. We have some great berberine and also collagen formulations on our website, Myoscience with an X. That's MYOXCIENCE.com. Okay, so let's get to some questions here and just kind of see if we can, talk through things here on a Sunday. But again, I just wanted to share this with you, not to like pump my chest and say, see, I was right, but two things, to think better when we make interventions. When we intervene in a system and we tell hundreds of millions of people to stay indoors for an extended period of time, to don't leave their house, that they can't go to a gym, we need to think through what the ramifications of that will be. And do like a risk analysis and say, okay, well, if we slow down the spread, but we have all this collateral damage, all this increase in obesity, all this increase in diabetes, all these increases in blood pressure, but at what point is the inflection point where our interventions are worse than if we were to just, tell people to be careful, exercise caution, go to the gym, but socially distance, wear a mask, do these things. Why didn't we do that? It really is frustrating because we took a lot of steps back. And when you get unhealthy, it's hard to get. It's really easy to get unhealthy. All you have to do is you can drink more, you can eat more crap, and not exercise. But when you want to go in the reverse direction, it's much more challenging. It's like you're pushing a heavy wheelbarrow healthy. Okay, looks like we have some bandwidth issues, but let's get to some questions here. All right, guys. It's saying that I have some bandwidth challenges here. So maybe you can or can't see me. Yvonne, Linda, what's going on? Why does... error is not receiving enough